tell us, what preventive things can we do to take control of our diabetes risk?
You know, we talk a lot about what you eat, and that does play a big role. But I've been talking to people about what they're drinking. A soda has 11 teaspoons of sugar. Iced tea has 8 teaspoons of sugar. Compare that to water, which has none. That's going to be the better choice. You know, we have to look at labels sometimes because even in foods we think are healthy, there's hidden sugar. Pasta sauce. Some of those yogurts that are fruit flavored have as much sugar as candy. It's condiments such as ketchup, and granola bars typically are bound. That sticky substance typically is sugar. So you need to be on the lookout for what you're consuming in terms of the sugar content.
Such a great point, Dr. Whyte. Such a great point. And you know what? I started looking at a lot of labels and I could not believe what I saw. You know, I would pull a soft drink off the shelf and I would look at it, would say like 50 grams of sugar. And I would picture that in my head as like a little pile of sugar. Listen, you guys know that I'm a gym guy. I love to work out. I'm always talking about getting into the gym and working out. So what does the science tell us, Dr. Whyte, about exercise and about movement and physical activity with regard to diabetes?
I mean, as you know, exercise is almost like a magic pill when it comes to our blood sugar. It really brings that glucose into our cells. It makes them more sensitive to insulin. So even if they're resistant to some degree, you can bring it in through the power of exercise. The ADA recommends 150 minutes of exercise a week. That can sound like a lot, Dr. Sportelli. We're all not going to be able to do that. But here's the good news that we've learned in recent years. High interval training, 30 seconds of high interval training followed by 30 seconds of rest. Do that 4 times. That's 4 minutes. 4 times a week. That's 16 minutes. Significant data has showed that might return you to a normal blood sugar. So it's about exercising smarter, not longer.
Gotcha. Dr. Whyte, if you have diabetes, you're not doomed. There are things you can do to turn it around, correct?
And Dr. Worden, that's what I'm most excited by. If you asked me 5 years ago, I would say to you, you know, there's nothing that you can do. You're going to progress to diabetes. And if you have diabetes, you're going to progress to being put on more medications. But what we've learned in recent years is that you know, the beta cells of the pancreas, which are responsible for insulin release, can regenerate and regain their function if we make these lifestyle changes typically within the first 3 to 5 years of diagnosis. So instead of progressing to diabetes 5% every year, you might be able to reverse that progression or at least put it in remission. Now there's a lot of tech tools and apps that we have. You can wear a continuous glucose monitor. I'm wearing one to see how my body responds to a certain type of food and exercise. You can take pictures of food and it'll tell you its nutritional content. You can breathe into devices and know whether you're burning fats or carbs. Lots of tools out there, gentlemen, that folks can use to help them control their blood sugar.
Well, as you always say, Dr. Whyte, take control of your health, right?
That's right. Absolutely.
Great tips today. Thanks so much, as always, for joining us.
Always good to see you. Thanks for having me.
For more information on type 2 diabetes and Dr. Whyte's new book, Take Control of Your Diabetes Risk, check it out at our website at thedoctorstv.com.